Today, I want to remind you of the dangers posed by handling of physical money in business transactions. In my earlier briefs, I encouraged you to transact electronically, minimizing handling of cash. Despite mobile money operators facilitating the ease of doing e-transactions, we have noted with concern that people continue to disregard this advice. Once again, I am asking you to take all the measures that you can to avoid exchanging notes and coins. Physical money presents surfaces that can very easily be contaminated with the virus. Avoid it. The Ministry of Health, together with the Ministry of Environment and other government agencies, have developed and circulated a protocol on COVID-19 waste management to the county governments for operationalization. In the meantime, all of us are advised to properly dispose of face masks to avoid contamination in line with that protocol. We continue to enhance our capacity and capability within our health facilities to combat this disease. To date, over 100,000 healthcare workers have been given COVID-19 related training. Over 4,000 doctors across the country have benefited from an e-based training on the same. We are enhancing testing and other capabilities. We are now able to undertake an average of 600 tests a day. This number will be scaled up in the coming days. Indeed, today we received Roch-19 testing extracts, which creates our capability to test automatically rather than testing manually as we have been doing. To continue to enhance our readiness at the counties, and in collaboration with the Ministry of Energy, Kenya Power and Lighting Company will fast-track the connectivity of three-phase power to our various county facilities so that they can fully utilize medical equipment to effectively manage COVID-19 patients. Fellow Kenyans, since our last briefing yesterday, we have continued to test and managed to test some 504 samples. Out of this number, some 5 have tested positive for the coronavirus disease. Therefore, we now have 189 Kenyans with confirmed positive, confirmed as positive. These 5 people are all Kenyan nationals, and only one of them has a history of travel from the UAE. 3 of the cases are in Mombasa, while Nairobi and Nyandarua have 1 each. 1 case came from mandatory quarantine facilities, while the others were picked by our surveillance teams. The 5 are aged between the ages of 27 and 58 years old. 2 are male, while 3 are female. But I'm also glad to note that today, an additional 10 individuals will be discharged from our Bagathi COVID-19 isolation facility. And this is good news indeed. It is a Good Friday. For the first time in a day, we released more people than we took in. The individuals have tested negative twice, and that brings in a total of 22 individuals who have recovered from the disease. To date, a total of 6,192 samples have been tested. Once again, I would like to reiterate the importance of observing the various measures and guidelines issued to combat the virus. I want to remind our young people, the youth, of the discussions that we have had on the various days on the role that they can continue to play. And I'm glad to report that we have had communication with a lot of youth groups who have contacted us with ideas on how they can help in the villages, in the estates, and we continue to encourage them to do so.
And we have decided as a result of that loophole to be able to expand the scope of the case definition to include severe pneumonia as a criteria for testing for COVID-19. And this information has already been passed over to the clinicians and healthcare workers that anybody presenting with severe pneumonia ought to and should be tested for COVID-19. The measures that we have undertaken as a result of this is, one, to provide psychosocial support to the healthcare workers who took care of these diseased persons. Number two, we have also gone ahead to ensure that the facilities have been disinfected. We have also placed the healthcare workers who took care of the diseased persons in quarantine for the next 14 days. And of course, contact tracing and testing has commenced to be able to find out whether during that exposure they actually got the virus. Let me also take this opportunity to address the issue of the masks. Yes, we want to appeal to the members of the public, and this will only happen through continuous education and behavioral change, that the N95 masks should be left to the healthcare workers. The rest of the population can be able to use the ordinary face masks. And in terms of the projections, yes, we still stand with our projections that we gave you initially. Reason is that we have not gone to do community-based testing, and the results that we have been relaying to you here on a daily basis are basically results from our quarantine sites and a few cases that are picked by the rapid response teams. So we still stand by our earlier projection. We don't know what is going to happen, whether the figures will match or not, taking into consideration that also the measures that we have undertaken could also work in our favor.
Are we still working on that model? Are we working with that for those who have been exposed during